then I want you to understand that you have an irrigation tray. We don't have one here. That's been unopened. So don't throw yours away. You have one, and you've got to keep it for the next 2 years. So please be sure you don't throw that away. But this is actually in an irrigation tray with a plastic little barrier in there also. Okay, so the inside of that package, like you're going to be able to reach in there and take this out, and you're going to be able to reach in there and get out your barrier. Okay, so I just want you, you're just going to have to kind of visualize that, because if you have questions when you get to that point this afternoon, just please ask. Okay, but we're going to pretend like this is in a tray. Okay, that's my irrigation tray and my wound dressing change tray. Okay. And if this looks a little different than yours, it should still be, the same thing. Yeah. Okay.
Universal beginning steps.
Okay, so, hello, Mr. Jones. Going to be taking care of you today. It's time to change the dressing of the wound on your stomach, okay? And you're going to find wounds attached to the clients. They're mostly going to be taped to their leg or their abdomen. And so you want to just be sure that you don't untape the wound, just untape the dressing. Okay?
Pre-medicate client if necessary according to doctor's orders.
Okay. And then he called out for pain medication, so he's 30 minutes. He got pain medication 30 minutes ago, and that's a perfect amount of time.
Place red bag and garbage can at bedside within easy reach.
I've got a garbage can right here.
Expose only wound area.
Okay.
Wash hands and don clean gloves.
Okay. Thank you.
Remove dressing. Observe for amount and characteristics of drainage. Fold with drainage to inside. Note odor, color, wound healing, drainage, and inflammation, and dispose in red bag.
Okay, and so in that, I'm going to take all that out all in one. So that was down in there, just so you see that out there. I'm just going to take that out like that, okay? Take a good look at it. Make a note of what I see on here, because that's going to need to be included in my documentation, okay? And so that's going to go in a red bag.
Do we verbalize what we see, or just?
Yes,
okay.
you can, or just write it in your note. It doesn't matter. And you'll just kind of have to, some may have something, but you can just write serous sanguineous
Just make it
drainage
up.
noted, moderate amount. Yeah.
Open sterile cotton applicators. Maintain sterility. Measure wound, including length, width, depth, and record findings.
Okay. Would someone go to that top drawer in the wound care cart and get a sterile cotton tip? We're going to assume they're all sterile because they're in the cart for y'all. I don't think you have those in your kit. They're in that top. And there's also a measuring, like a little.
Yeah.
We got the trash can.
Should we
It is.
just start over? No.
Yeah, let's
So
try
we've
it.
done we've done universal
Okay.
beginning steps. I've exposed only the wound portion of my client, and I have removed the dressing.
Remove the dressing. Okay. Open sterile cotton applicators. Maintain sterility. Measure wound, including length, width, and depth, and record findings.
Okay. Length is going to be measured from head to toe. So I'm just going to lay that, kind of hover it over the top of the wound, and it measures right at 9 centimeters. 8.5 to 9 centimeters. So just say 9 centimeters length. The width is 2.5 centimeters. And then the depth, I'm going to insert the Q-tip to the deepest point of the wound, and it's sterile. And move my fingers to the very end of that. Oops. There we go. This goes right here to the point, to the deepest point, and then you just kind of move your hands to the edge of the skin So your fingers should be sitting at the edge of the skin, and the depth of it should be what is below the tips of your fingers. Does that make sense? And then you just hold this up next to your little measuring device, which is in the cart, and it's 2 centimeters deep. Okay?
Remove gloves and wash hands.
And save the Q-tip. Okay.
Prepare sterile supplies.
Okay.
Open package. Note the direction and method in which the package is opened.
So
Remove sterile barrier and sterile gloves.
removing the irrigation tray, opening the irrigation tray, and I'm opening the sterile tray. Always opening away from
Place barrier shiny side down beneath wound next to client.
okay. Open the irrigation tray, taking out only the irrigation container, and I'm going to take this right here, shiny side down. Let's see.
So can you touch the top of it?
Yes, you can, because this is not part of your sterile field.
Okay.
Your sterile field is going to be right here only, okay? That can go there, and my tray, my irrigation tray, is going to sit right here to catch the water, okay?
Using sterile technique, put irrigation syringe into or onto sterile field, removing only irrigation container.
Okay. And I might have got ahead of myself a little bit. I'm going to take my gloves out, and touch the tape and take it to the side, and then I need to get this barrier here. I cannot touch the inside of it, okay? This is my sterile field. Okay? And read what you just said again.
Using sterile technique, put irrigation syringe onto sterile field, removing only irrigation container.
The irrigation container is not sterile. Cannot be touched except with clean gloves or clean hands. This syringe is going to remain sterile because I have to use it during the sterile procedure. So I'm going to gently lay that there. Okay?
Position irrigation tray on barrier below the wound to catch irrigation.
And there I set my tray.
Touching only the edge of the dressing tray on the sterile field. Empty sterile contents onto sterile field. Place tray away from the sterile field, maintaining sterility of inside of container.
Okay?
If the sterile water has been opened, lip it before pouring. Pour the ordered solution into sterile compartment of sterile tray for packing and into sterile irrigation container for irrigation. Remember, the outside of the container is not sterile.
Okay? And this has normal saline in the kit. I don't know if your kit has it in there or not. We have it right out there, okay? So this is not present in the sterile field. If it is in there, you could, number one, go ahead and put your sterile gloves on and then place the solution into the sterile irrigation container. If you just remove it from the table, from the cart over there, it's sitting on your table already. It's not a part of your kit. So I'm going to lip it, and I'm going to go ahead and fill up my irrigation container.
Don sterile gloves. Add sterile gauze mesh 4x4s into saline solution.
So I need to pour it into the irrigation, and I also need to pour it into the tray. Okay? And you notice how I've got this stuff set up. I'm not having to reach over anything. I can reach around. Okay? And now sterile gloves.
For the saline, is it a certain compartment that we need to pour it in like
It
yesterday?
doesn't matter. And it doesn't even matter with the trach. There's nothing wrong with which compartment. You just gotta know, where you put what, because it all looks clear. Okay? Whew. I have a new package of sterile gloves. A brand new package.
Add sterile gauze mesh 4x4s into saline solution.
I'm gonna keep 2 for drying.
Fill irrigation syringe with solution. Holding syringe tip about an inch above the wound, gently flush all areas of wound. Continue flushing until solution draining into basin is clear.
Okay, and I can re-enter and do that again. Just run clear.
Dry surrounding skin gently with sterile gauze. Grasp center of gauze to blot. Be careful not to contaminate sterile gloves by touching wound. Use a new gauze for each wipe and place used gauze into waste receptacle. Using betadine swabs, clean center of wound, then clean each side of the wound. Dispose of swabs.
And this does not have betadine swabs.
It says do not open pack. Simulate.
Okay. Here's my betadine swab off my sterile field. Center, remember center, and then outside, new one, outside.
Squeeze excess fluid from gauze dressing. Unfold and fluff out the dressing.
Squeeze that out, and then we can unfold it.
Gently pack moistened gauze into wound. If wound is deep, use forceps or cotton-tipped applicators to press gauze into all wound surfaces.
So keep you plenty of sterile cotton tip applicators.
Apply several dry, sterile 4x4s over the wet gauze.
Okay.
Place ABD pad over dry 4x4s by grasping in center. Secure dressing with tape, Curelex gauze, or Montgomery ties. Mark label with date, time, and initials and place on dressing.
Okay, and I would put 3, 30, 29, 16. It was 1040 JRC.
And would you do that with your sterile gloves on?
No.
Dispose of equipment in red bag. Put sharp objects in sharp container. Remove and dispose of sterile gloves. Dispose of the contents of your red garbage bag according to facility protocol and universal ending steps. And document.
Mr. Jones, let me know if you have any problems, if you need anything.